Hi, I'm Dr. Stephan Smith of Advantage Family Chiropractic, and today I'd like to talk a little bit about pregnancy, particularly pregnancy as it relates to the spine and the joints of your body. In our practice, we have women who will come in as new patients pregnant because they're having low back pain. That's a very common thing. We'll also, of course, have existing patients in our practice who will become pregnant, start a family, and their low backs will start to bother them a little bit more. And it's not just low back; it's mid back, it's neck, it's a lot of different things. Part of the reason for that is because as a baby develops, as your body moves towards that delivery date, your body will start to secrete different hormones in preparation for that delivery. One of the hormones is, appropriately enough, called relaxin, and as the name implies, its function is to allow your body to relax, allow ligaments to become more pliable, more stretchy, because it's preparing basically your pelvis to be able to open up as that baby comes through the birth canal and is delivered. The problem is it doesn't just have a local effect on the pelvis, it affects all of the ligaments of the body, all of the joints of the body. And so you'll have ligamentous laxity or stretchiness kind of everywhere, and it allows your body to kind of fall out of its normal biomechanical shape. So women will start to have low back pain because that relaxin allows their lumbar curve to kind of increase a little bit more. So as that baby, the weight in the front increases, it kind of pulls their low back forward and creates kind of you've heard the term sway back. It kind of creates an increase in that lumbar curve, which pulls everything forward, and it hurts. So they'll come in for relief. My wife was adjusted through all three of pregnancies with our three kids, and she had very little problem during her pregnancies because she was being adjusted throughout her pregnancy. Now, I know people sometimes have apprehension about chiropractic in general, but particularly when they're pregnant, they're afraid something's going to go wrong. There's no problem with getting adjusted when you're pregnant. It's a very beneficial thing. We're working to realign the vertebra so that that extra weight, that extra ligamentous laxity doesn't cause long-term problems, long-term damage. The other thing that can happen is as you move along in your trimesters and that baby develops, the other thing that can happen is that your pelvis will start to ache because the weight of that baby pushing on the pelvic floor puts pressure on those spinal nerves too. So being adjusted helps realign everything, takes pressure off the pelvic floor, and makes that a whole lot more comfortable as well. My wife really didn't have any issues at all during pregnancy as she was being adjusted, and the deliveries of all three of our kids went remarkably well. And that's another thing. I mean, our kids were adjusted. I adjusted my children when they were a day old. Oh no, everyone's going to think that's a horrible thing. Adjusting the spine of an infant is a very delicate, very simple little thing to do, but it's so remarkably important. Just imagine the kind of trauma that occurs when that baby comes through the birth canal, particularly if you've got the doctor with their hands around that baby's neck, basically pulling, tugging, twisting to help deliver the shoulders. And if you think a cesarean delivery is easier, you're wrong. It's more difficult because the incision that is made to deliver that baby is only as long as it absolutely needs to be to get that baby out. So there's a lot more pulling, twisting, and tugging. Google it sometime and watch how traumatic a cesarean delivery actually is, and watch what happens to that baby's neck, and you'll want to get your baby checked. I'm Dr. Stephan Smith, and I want to say, if you're pregnant, give chiropractic a try. You won't regret it.